In our practice, a frenectomy is reserved for infants. A frenuloplasty is something that we would do on children and adults to release those tethered oral tissues. The technique was coined by Dr. Sarush Zaghi at the Breathe Institute, where we trained, and we follow his techniques. The process involves coordinating with myofunctional therapy to make sure that the procedure is needed, first of all. The reason we would do a procedure is to be able to achieve our myofunctional goals. And the procedure involves preparing for the procedure with myofunctional therapy, and then in the procedure, releasing tension from the tissues that are restricting the movement of the tongue. Afterwards, there's a rehabilitation process with the myofunctional therapy. We also will use sutures to close the surgical area and make sure the patient is supported postoperatively. So in our practice, we say that patients can have a functional frenuloplasty who are the age compliant and up. So if a patient's able to sit for dental x-rays and sit for a cleaning, they should be able to sit for a functional frenuloplasty. It's really not much different on their perspective than a filling, for example. Patients who are candidates would be people who have oral restrictions that are causing a functional issue. Either not able to move the tongue in an appropriate way, or we're seeing growth and development concerns because of the tethered oral tissue. The functional nature of the procedure is important because that's also what's determining our endpoints. I think one of the common questions is, when are we done? And we are done when we have released tension and when the tongue is able to move in the appropriate way. A lot of times we're getting input from the therapist during the procedure, but we're also just able to kind of evaluate tension and movement throughout the process. And that's why it's important that the patient is awake for this process. The myofunctional therapy aspect of this procedure is the most important part. And we only do a release of tethered oral tissues in order to facilitate the actual myofunctional therapy, because it's all about function and we want to make sure the tongue can move in the appropriate way. Myofunctional therapy is vital to treatment success for a lot of reasons. First of all, it's so that we can achieve our end goals, which are therapy related, but also so that the procedure itself is successful. So when we're doing a procedure, if a patient has really committed to their homework and doing their therapy well, the procedure goes a lot smoother. The reality is that a patient is going to be asked to do a lot of movements of their tongue during the procedure. I need to be able to access that area to get to it with the laser to do the release. And it takes a lot of strength to kind of lift and hold, have the process, and then relax. And we go through that, many iterations of that until we've released all the tension. We want patients to be able to hold that lift motion of the tongue for long periods of time during the procedure. And it's harder to do when they're numb. So we want to kind of really prepare in advance when they have full feeling of their tongue, so that that muscle memory is there during the procedure when they have anesthesia on board. The myofunctional therapy also moves the structures so that all of the vital structures are out of my way. There's 3 layers in the tongue that we're gonna be working on. There's mucosa, there's fascia, and there's muscle. And so we will kind of work on the areas that are needed that are causing tension, but what we don't want in the area is blood and nerve supply. So those structures actually move to the back once we've done the therapy, so that I have access to the tissues I do want to work on, which is the mucosa, the fascia, and the muscle. So I usually will allow about an hour for a functional frenuloplasty, but that involves making sure we have all the preparation done. So the consent forms and going over post-op instructions, anesthesia, laughing gas or nitrous oxide if it's needed, and the suturing process. Those are the main steps that happen in the procedure. I want to make sure that everyone's comfortable with the aftercare. Usually you'll see your myofunctional therapy a few days later, and then we'll usually see you twice afterwards to check on the healing. The sutures that we use are dissolvable, so some of them may come out or dissolve throughout the first few weeks. That's okay, and we just want to make sure that we're checking up on all the healing, making sure things are going well.